Let's talk about hysterectomies. If the idea is sort of circling your mind, I want to let you know that you are not alone, okay? It is the second most common surgery among women in the U.S., only behind C-sections, and a third of American women will have one by the time they're 60. So the question is why? And beyond that, what are the side effects? Well, that's where Dr. Angela DeRosa comes in with some of the answers. First of all, good morning.
Good morning.
We want to start with some of the reasons women decide to do this in the first place.
Well, oftentimes, the most common reason is that they're having uterine bleeding that's kind of heavy and they get very painful periods. That's often due to uterine fibroids. And if we always say 40, overweight, those women typically will develop these fatty tumors that are estrogen derived and they get very heavy bleeding. Number two would be uterine prolapse. So Scott, get your catcher's mitt. It's when the uterus comes out through the vagina. And number three is endometriosis. So
wow.
They're very common reasons, and women, as they get older, they start to suffer from those.
Okay, but the one thing that you say, the importance here is to get a second opinion.
Yes, because there are often non-surgical options to treating all of those conditions, and certainly some surgeons might say maybe a little more happy-go-lucky about wanting to take your uterus out. It's a big surgery. Certainly doing it laparoscopically has made it a lot easier in the recovery time versus a full open hysterectomy, but get a second opinion because some doctors are more apt to want to take your uterus and not understand the consequences.
That seems, I mean, why? I don't. I guess I'm hearing this, I'm thinking, what would the benefit of it be other than what's obvious?
Well, some surgeons, they're gynecologists, and they're great gynecologists,
sure,
but that's how they make their living and doing surgeries. And oftentimes, they may be more apt to want to go ahead and do that when conservative approaches may be more beneficial. With that said, though, these are good surgeries to have done under the right circumstances, and you just need to make sure it's the right circumstance.
Okay, so you're going to want to watch for hormonal deficiencies.
Yes, and what they don't tell you is this, when they do the surgery, they clamp off arteries that not only feed the uterus, but feed the ovaries. And even if they leave your ovaries behind and they leave them in, that surgery actually causes a mini stroke to those ovaries during that surgery. And then when they take the uterus out, they also take blood vessels that are going to feed the ovaries going forward. So now you have ovaries that have taken a mini hit stroke.
Yeah. And
now you have decreased blood flow, which all leads to an immediate decline in hormones. So all women post-hysterectomy will have 100% deficiency in testosterone and 50%-ish estrogen deficiency. That's leaving both ovaries. Now, if you take one out, you even take a more dramatic hit. So you need to, not that that's a problem, you just need to know it's going to happen and prepare for it.
Sure. Okay, so as I'm hearing you say this, I'm sitting here thinking, okay, uterus, 1 over 2. You say take the ovaries as well.
If you're younger, say 20s or 30s, there is a benefit to leaving the ovaries because they do have function.
Sure.
But if you hit the age of 40 and above, take the ovaries out because you're going to take that huge hormonal decline anyways. I can give you back your hormones. If you leave the ovaries, you leave a nidus for ovarian cancer down the road, and it's very hard to detect. Most often, by the time we find an ovarian cancer, it's too late. So if you're getting close to the menopause, just take the ovaries anyways. I can replace hormones.
Okay. Thank you for your time.
You're
we appreciate
welcome.
it. It's a lot of information, but hopefully we've answered some questions for people out there who might be suffering.